So, thank you so much for inviting me. I'm going to be looking at advancing health equity and amid the maternal child health catastrophe in Gaza. So I've been to Gaza 4 times, starting in 2005, each time invited by the Gaza Community Mental Health Program. Each time I went with a different NGO. And so I've done direct services, women's empowerment, a lot of documentation, interviewing people. And as mentioned, I work with some organizations that are very focused on Gaza. The one I would particularly point out is We Are Not Numbers, which is a program that mentors young Gazan writers with native-speaking English writers. I'm the mentor liaison and on the management team. So, as you probably know, Gaza is a tiny strip of land, 26 or 8 miles by 6 miles, located just next to Egypt. The thing to know is if you take the strip and you put it on the state of Massachusetts, which is a very tiny state, you can see exactly how tiny Gaza is. 83% of the Gaza Strip is now under evacuation orders or is designated by a no-go zone by the Israeli military. And in the midst of this, there are some 2.1 million Gazans, and half of them are under 18. So we all know that healthcare and health occurs in a socio-political context. So in Gaza, what does that mean? So healthcare in Gaza is provided in the context of a siege, checkpoints, closures, curfews, a strict permitting system for both people and materials, meds, and such things, a separation wall fence that goes along the perimeter, and multiple Israeli incursions, occasional massive assaults, frequent detentions, and factional violence. Now, some facts about occupation so we all are on the same page. After the 48 war, Gaza was controlled by Egypt. In 67, it was occupied by Israel, and then the Israeli government encouraged Jewish settlers to come live in Gaza. They were unilaterally withdrawn in 2005. The following year, there was a democratic election certified by Jimmy Carter, and Hamas won the legislative election. The following year, there was a civil war between Hamas and Fatah. Fatah was partially funded by the US. Hamas won, and the siege began, led by Israel and backed by the US. Since then, and I want you to imagine being a kid growing up in Gaza, how many wars you have lived through. So since then, there have been multiple Israeli assaults, and these are the big ones. 2008, 2012, 2014, 2021, 2022, and then the one that started after the Hamas assault on October 7th. In addition, between 2018 and 2019, there was a weekly, mostly nonviolent protest to the perimeter fence with Palestinians demanding their rights, and they were met with sniper fire aimed at their legs, creating a massive amount of orthopedic injuries and death. Now, if you look at healthcare in Palestine in general, the Lancet has described it as fragmented and incoherent. So what are the systems that run this healthcare system or non-system? So the Ministry of Health was established in 1994 after the Oslo Accords, and basically their task was to set up a healthcare system, but they were setting it up under occupation. Then we have the United Nations Relief and Works Agency, or otherwise known as UNRWA. And this was set up in 1950 after the 48 war to provide healthcare, education, food, and such things to the people who'd been created as refugees during the 48 war. So in Gaza, there were eight poverty-stricken, crowded refugee camps. In the West Bank, there are 23, and then there are a host of them in Lebanon, Syria, and Jordan. Then we have non-governmental organizations that provide health care, and then we have private providers. And overriding all of this is the role of the Israeli government in an active program of de-development. So the Israeli government has a policy of crushing the healthcare system through not allowing people to get training, not allowing medicine and equipment to get in, etc. Now, I want to mention that if you're a Palestinian with a East Jerusalem ID, or you're a Palestinian with Israeli citizenship, you do have access to 5 first world HMOs as well as private care. Now, before the 2023 aggression, there were 13 governmental hospitals. There were 142 primary healthcare centers, 50 run by the Ministry of Health, 22 run by UNRWA, and 70 run by NGOs. There were also some private hospitals, 2 medical schools, and a bunch of professional schools like nursing schools. But there's a real disconnect in Gaza between the professionals that are available and the paid positions that are there for them. So there are 120 nursing positions available each year, and there are 5,000 nursing students. There were less than 20 psychiatrists in Gaza, and less than 7 were physicians. Now, before October, there were some very major health issues. One was the lack of electricity, 48 hours a day at erratic times in the 24-hour cycle. So most hospitals ran on generators and needed fuel. There were chronic fuel shortages, so occasionally hospitals had to close. And then we had all the restrictions I mentioned on permits for the patients to be able to leave. They had to go through bureaucratic hurdles to get to high-level care, mostly in East Jerusalem. And then a chronic lack of medicine and equipment. The other thing with the personnel is that people couldn't go out to train, so there was a lack of specialists. So although people were highly trained, they couldn't advance their training. So the medical personnel are chronically exhausted. Very often their salaries are unpaid, and the COVID pandemic really did a number on the healthcare system and the personnel. Now, if we're focusing on women, there are lots of challenges for women in Gaza. It partly depends on your socioeconomics, whether you're urban or rural. Women tend to be encouraged to marry early and to have large families, and they tend to be responsible for all of the children. It's a society that has a variety of attitudes, but the tendency is towards more conservative attitudes towards women, particularly around what their roles are and responsibilities and LGBTQI. There is a tremendous stigma in the society regarding admitting to mental health disorders as well as obtaining mental health care. And many people argue that everyone in Gaza has, chronic traumatic stress disorder and depression and anxiety, and so it's millions of people who really are in need of care. There is a huge amount of poverty. There is some gender-based violence, and I've interviewed women about this, and the stories that I heard were they married some guy and everything was fine, and then he gets picked up by the Israeli soldiers and taken off to prison for a couple of years where he has a fairly brutal experience. He comes home, he's a broken man, he's been emasculated in terms of being able to care for his family. His kids don't recognize him, he can't find work, and he beats his wife, and that's sort of a classic gender-based violence cycle. There's also racism within this society. If you look at how Gazans look, there are people who are blonde and blue-eyed, and there are people who look like they're from Africa. So there are people from particularly Chad who came up to the Holy Land and stayed in Gaza, in Jericho, and East Jerusalem. And so if you're a black woman in Gaza, you have less status than if you're a white woman, and you're less valued in terms of being a potential bride. Women tend to be highly educated, but very few can find paid employment. They suffer from the trauma of occupation and siege and an immense amount of loss. When you look at the healthcare providers, there's a range of quality of healthcare providers and a range of access to healthcare. So frequently I talk to pregnant women and they would start out in an UNRWA clinic, but they wanted an ultrasound and they went to a private provider, and then they needed medicine and they went to the Ministry of Health. And so the prenatal care is fairly jumbled. And there was an attempt to get everybody to carry a little card, but there is this sort of fragmentation of providers. There's also a lack of screening and diagnostics, particularly in mammograms. There's no screening mammography. So there's a lot of women who suffer from more advanced cancers because of the lack of screening and the difficulties in obtaining permits for high-level care, as I mentioned. There are also tremendous strengths of women in Gaza. They are the main cohesive force within the family. I mean, you want to be in a major celebration, be in Gaza on Mother's Day. It's like an amazing thing. They are highly valued. They have multi-generational connections. The family situation is very supportive usually. They are known for their samud, their persistence and their strength. They tend to be highly educated, and there's a tremendous amount of pride in things like cooking and embroidery, and this kind of joy and love of life, which constantly surprises me in a place that seems so devastated. Now I'm going to look at some equity issues, and so first, just for definitions for people who don't know this, maternal mortality is defined by female deaths related to pregnancy within 42 days of the termination of the pregnancy, whatever kind of thing, childbirth or loss or whatever. Infant mortality is defined as the death of an infant before their first birthday. So if we look at maternal and fetal mortality in Israel, depending on your sources, it's somewhere between 2 to 5 maternal deaths per 100,000 live births. and 3 infant deaths per 1,000 live births. Excellent, excellent numbers. And so this is a reflection of the universal national health care insurance, the network of community-based primary care and preventive maternal and child health clinics, universal school-based health services, an excellent system of tertiary level hospitals. People come from all over the world to go to Israeli hospitals, rare levels of infection except during COVID, and high immunization rates within the population. Now, if we look at Palestine, again, these numbers are somewhat hard to get, but in 2020, the maternal death rate was 28.5 per 100,000 live births. It had gone up from 5.9 in 2017. This number is partly a reflection of the impact of COVID on the women and the impact of COVID on the healthcare system. In terms of infant deaths, the numbers are between 12 and 15.3. And if you look at trying to figure out this kind of data, it's estimated that in third world places like this, there's a 30% underestimation of death rates. So the numbers are probably higher. And obviously, this is a reflection of the many structural issues in the healthcare delivery system and the care by multiple providers and the fragmentation. There's also a very poor quality of reporting maternal deaths. I kept finding this phrase, verbal autopsy, which I assume means that there was no autopsy and the clinician said she died of XYZ. So it's thought that the completeness of female death reporting in Gaza is about 72%. It's also thought that about 78% of maternal deaths are preventable. Now, what are the causes of maternal death in Gaza? It's primarily bleeding to death and sepsis. And that's opposed to the West Bank, where it's pulmonary embolism and preeclampsia, again, reflecting that Gaza is much more third world than the West Bank. Now, there were some predictions made by the London School of Hygiene and Tropical Medicine and Johns Hopkins, looking at a public health analysis of what's happening during the war. And so this came out in November, so about a month after the war started. So first of all, they said there are multiple typologies. We're looking at armed conflict, forced displacement, a slow onset of food insecurity, a near complete blockade of humanitarian and other supply chains, as well as a high number of casualties and injuries, including frontline healthcare workers, and a collapse of facilities and health service components. So they said, okay, what's going to happen to the nutrition? So they said at 1 month, they're going to see insufficient dietary diversity, high anemia levels, and a low baseline of acute malnutrition. At 2 months, they predicted increasing malnutrition, an increasing burden of infant malnutrition due to disrupted feeding, difficulties with breastfeeding and getting formula. At 3 to 6 months, they predicted an increase in acute malnutrition and infections, epidemics of micronutrient deficiencies, widespread anemia, and we are now in the 10th month of this war. In terms of looking at maternal and neonatal outcomes, they predicted at 1 month increased risk factors for poor pregnancy outcome that are related to stress and inadequately clean birth facilities, as well as the lack of providers and unmanaged obstetrical and neonatal emergencies. At 2 months, they predicted worsening maternal nutrition and reduced access to obstetrical care, as well as to family planning. And I can tell you that most Gazan women use IUDs for family planning, and they use it for spacing. At 3 to 6 months, they are predicting worse birth outcomes with increasing stillbirths, early neonatal and maternal deaths, and this would be related to missing any antenatal care, the lack of skilled birth attendants, inadequate maternal nutrition, as well as an increase in the number of unwanted pregnancies. And then they said there are other things that are going to burden Gazans. There's going to be an increase in endemic infectious disease, fecal oral, as well as airborne droplets, and that this is going to be related to overcrowding and insufficient water, sanitation, and hygiene facilities. They said the treatment access is going to be very disrupted. The diseases are going to be worse because of malnutrition. The vaccination programs are going to collapse, so that's going to make things worse. And then if you think of people with chronic diseases, like if you're diabetic and your insulin supply is disrupted, you're going to be much sicker. There's going to be increasing pulmonary disease. There's a huge amount of pollution from the war materials in the air and in the soil. And people who have cancer or chronic pulmonary disease or renal disease are all going to not be getting treatment, so they're going to get worse. Cardiovascular disease is going to get worse, and it's also going to get worse because people are so stressed. And then you put on top of that war-related injuries, worsening mental health, anxiety, depression, suicide, gender-based violence, as well as rising levels of poverty in a place that already was quite poor. When they looked at women and children, they said by 3 to 6 months, large numbers of women and children will be severely malnourished. There will be this epidemic of micronutrient deficiencies. With neonates and infants, they predicted a rapid deterioration of nutritional status because of maternal stress and poor breastfeeding, as well as inadequate clean water and contaminated formula. And they also noted that before this attack on Gaza, preventive, reproductive, and maternal and neonatal healthcare was what they called relatively okay. So if you look at the numbers, almost half of women use contraception, almost all of them had more than 4 prenatal visits, almost 90% had 1 postnatal check, and their level of high-risk pregnancies was around 10%, mostly diabetes and hypertension, and the C-section rate was 22%. And they also thought that death was related to sepsis and hemorrhage, again validating the numbers I said before, as well as pulmonary embolism. But they noted if this war continues, all of these factors will deteriorate. So in February, they came out with some more predictions. They said over the next 6 months, and they looked at different situations, epidemic, no epidemic, ceasefire, no ceasefire. But if there's nothing changes, they predicted an excess number of deaths of 58,260 people due to injuries, infection, and untreated chronic illness. They also noted that since the medical schools have been targeted and the staff has been targeted, there will be no people to train the next generation and bring the capacity back up. In June, they put out another prediction projecting 3,500 traumatic war injury deaths in the Rafah governorate alone, that's just in the south, in the next 3 months. The Lancet also came out with a study that looking at recent conflicts and calculating indirect deaths, in other words, the things that people die from that's not the direct bombing on your house, that the numbers reported are usually 3 to 15 times less the number that's actually being reported. So if you use that kind of calculation, we're talking 120,000 people already dead. So what do we see? I do this talk about 3 times a week, and every time I have to update the numbers, and they just go up and up and up. So the total killed in Gaza is close to 40,000. The Lancet says it's probably more like 186,000. There are 90,000 plus people injured. 328 Israeli soldiers have been killed in Gaza, a little over 2,000 injured, and there are probably about 115 hostages. If you look at the pattern of Israeli airstrikes, they continue to indiscriminately bomb, including hospitals, healthcare facilities, ambulances. There continues to be a full electricity blackout and a lack of fuel. There's also, given the catastrophic situation, increasing intracommunal violence and gender-based violence. The destruction of the healthcare system, this sort of massive de-development, has been termed a sociocide, a destruction of an entire society. So there are about 1/3 of the hospitals currently partially functional, with the emphasis on partially. These hospitals are massively overcrowded, not only with patients, but with people who are sheltering within the hospital complex. And these hospitals also keep being told to evacuate, and everybody tries to get out, and then everybody comes back, so it's very chaotic. And just because they're functional doesn't mean they're accessible. So it's estimated that there are 12 partially functional accessible hospitals currently. There's about a 60% lack of essential medications, and we know that hospitals and primary health centers are directly targeted. This has been documented on satellite imagery and on spatial analysis, looking where the hospitals are, where the bombs are. There are hundreds of health workers that are currently held in Israeli prisons. Many of them have been tortured, maltreated, and killed. The universities and the 2 medical schools are rubble. About 100 professors have been killed. And now we see medical students stepping up, trying to provide care without equipment, constantly in a panic about their own safety, and with minimal academic staff. Now, this issue of targeting the healthcare system, there is a article that came out in Conflict and Health, and they used publicly available data on where schools and hospitals and water facilities are, and then they overlapped that with satellite documentation where the bombings are and where the destruction of the infrastructure is. And they demonstrated a clustering of damage from Israeli assaults in those categories. So this isn't random bombing, this is targeted bombing. And it also, they looked at the use of 2,000-pound bombs, and this was just in the first 6 weeks of the war. So they said all of this was clustered over this civilian infrastructure in health, education, and water. So what is the result? There are over 727 personnel killed, almost 1,000 injured, 131 ambulances destroyed, more than 270 UN staff and volunteers. So more than 2/3 of the hospitals and UNRWA centers are not functioning. And the people with disabilities, with cancer, with renal failure have minimal to no care. And dialysis units has been a massive problem. And there have also been no medical permits allowed to the West Bank or Israel. If we look at children, people are now talking about the unchilding of Gaza, so the children are losing their childhood. They account to a third of all deaths, and they are by definition innocent. There are more than 21,000 that are lost, disappeared, detained, buried in rubble, in mass graves. There are some 17,000 that are unaccompanied or separated from their family. And there's actually a new diagnosis when they pull an infant out of the rubble and the entire family is killed. This is child without known family members. And oftentimes these infants, no one even knows who they are or what family they're attached to or were attached to. And to give you a sense of the chaos, on July 22nd to 24th, 182,000 people were ordered to evacuate from Khan Yunis in the south. And so you can imagine what this does to children. So they have high levels of mental health disorders, especially panic and aggression and bedwetting. The kids with cancer do not have treatment. A small number were able to go to Egypt in June, but it's estimated that there are 1,000 kids that remain with cancer untreated. There are more than 50,000 in need of urgent medical care, and they're having the same levels of malnutrition and starvation as everyone else. And in northern Gaza, it's estimated that the average caloric intake since January has been 245 calories a day, which is probably half of our breakfast. They're not in school, which is another catastrophe. And UNICEF has now declared Gaza to be the most dangerous place in the entire world to be a child. And there are a lot of places where it's dangerous. We see the weaponization of food. Almost the entire population is living under crisis levels of food insecurity. 1 million people face what's called catastrophic levels, which is otherwise called famine. And you see the Israeli pattern of frequent obstruction of aid deliveries, violations of conflicted zones. So a humanitarian convoy will get in touch with the Israeli Defense Force. They say they're going to be here. They say it's okay, and then the trucks come in and they get bombed anyway. We see closures of UNRWA aid funding, and in this chaotic situation, there's a real breakdown in law and order. And so we see there are gangs now that commandeer these humanitarian trucks and then steal the food and sell it on the black market for high prices. And then in the regular market, food is very expensive because it's very rare. There's also an increase in denial of humanitarian missions, particularly in the north. And in Israel, at the Kerem Shalom checkpoint, which is the main checkpoint that these trucks get in, there are now Israeli protesters preventing the trucks from going in. We also look at this environmental catastrophe as an ecocide. I think I missed a slide. Yeah, that's right. So there are now more than 37 million tons of debris, including hundreds of thousands of tons of asbestos. There are over 330,000 tons of solid waste, and that was in June. Raw sewage, which can't be processed because all the processing treatment facilities are bombed, is now continuously being dumped into the sea, where people are bathing, they're washing their clothes, and they're occasionally drinking the water. So when it's cold, the streets are flooded with, and raining, the streets are flooded with raw sewage. In the summer, the stench is unbelievable, and there's obviously a huge infection risk. So we see massive levels of chickenpox, scabies, lice, diarrhea, and respiratory illnesses. Over 100,000 people have hepatitis A. And I had an op-ed published in the New York Times about a pregnant woman that I followed, and her newborn did get hepatitis A. And then catastrophically, on July 19th, polio was found in the sewerage. And polio was eradicated from Gaza in the 1980s. And so not only is that horrific, but we have a whole year of children who have not had any immunizations. So they're at incredibly high risk. As I mentioned, there's a big issue with humanitarian aid. If you look at the level of restrictions, there is a 56% decrease in the Israelis allowing humanitarian aid since April. There are persistent severe fuel shortages, and at Kerem Shalom, there are hundreds and hundreds of trucks lined up waiting to get in. Sometimes they wait so long that all the food spoils and they have to dump it. And then if they get in, the roads are all cratered and bombed. They can't always even move beyond the checkpoint. And just to give you a sense of how bad this is, in July, the average number of trucks per day was 75. Now, before October, the average number was 500, and that was considered the bare minimum to keep the population alive. There have been airdrops and ships and that crazy pier that our government built that have all been totally inadequate to the task. So what we have are Palestinian armed groups continuing their indiscriminate rocket fire into Israel. We have an enormous amount of on-the-ground fighting that looks much more like guerrilla warfare. We have civilians caught in the middle of this. And many humanitarian and legal groups are now saying that this has risen to the level of a genocide with multiple war crimes. There are intermittent talks of ceasefire that go nowhere. Now I want to talk briefly about UNRWA because this provides for the health care for 70% of the Gazan population. So Trump slashed the funding, Biden partially restored it, so UNRWA was kind of limping along. And then the war happened. In January, the Israeli government accused UNRWA of having 12 employees participating in the Hamas assault. Immediately, without further investigation or looking into the charges or whatever, 20 countries suspended funding. They've all put their funding back except for the United States. And Israel is really bent on destroying UNRWA. So the Knesset recently passed some bills to get UNRWA evicted from their East Jerusalem headquarters, deny visas for staff, stop access, remove their tax exemption, things that are going to make it really, really hard for them, like blocking their bank account to function. And our Congress is doing its part. In March, the Congress voted to bar UNRWA funding until March of 2025. They voted to cut funding to the UN Human Rights Council unless it certifies it is, quote, taking significant steps to remove Israel as a permanent agenda item. Our Congress banned funding to the UN Commission of Inquiry on Israel, and it voted to limit aid to the Palestinian Authority if the authority initiated or supported investigations in the International Criminal Court regarding Israeli crimes against Palestinians. But I want to be clear, the bottom line with UNRWA is if UNRWA is destroyed, it will undermine the education, health, and other services that are essential to the survival, the human rights, the continued existence of Palestinian refugees created in 1948 and 1967. And this is a bombed out UNRWA school. Now, I also want to remind people about hospitals and international law. The Geneva Conventions of 1929, Article 19, stated quite clearly that medical establishments and their staff and their patients are not to be attacked. It's a protected group. And the bar for hospitals to lose their protected status under international law is very high. And no one except Israel feels that the conditions have been met for any of the 36 hospitals that have been damaged or destroyed. And even when you're bombing a hospital, which is not recommended, the military is required to protect patients and staff, which clearly has not happened. So I want to walk you through what happened to Al-Shifa Hospital. This has happened to a lot of hospitals, but I have a lot of data on this, and it really will give you a flavor for what it means to destroy a hospital. So this is Al-Shifa Hospital, the main hospital in Gaza City, 700 beds, serving a huge number of people on a big complex with 1,500 medical staff employed. Now, before November 15th, the Israeli forces had bombed the coronary care division, a warehouse, the maternity floor, and the outpatient clinic. On November 15th, Israeli troops and tanks entered the hospital. They took control of several sections and interrogated people. They attacked nephrology, internal medicine, and detonated a medicine storehouse. There were at that point about 7,000 people who were not patients sheltering in Al-Shifa. At 9 a.m., they ordered everyone to leave in 1 hour, which was clearly impossible. There were no ambulances. Everything was in a great state of panic and fear. Many people left on foot, and there are pictures of people pushing wheelchairs and gurneys as they try to get patients out of danger. And the people who couldn't leave were left with a small number of staff. The Israeli troops ordered all the young men on the grounds to surrender, and this was, relatives, people sheltering patients, and they took captive dozens of men and relatives, etc. Many of the Palestinian men were interrogated. Many were held naked and blindfolded in their underwear. Some were just taken off to unknown locations. The Israelis accused Hamas of placing a command center below Al-Shifa, and the hospital officials totally denied this claim. The New York Times had access to the hospital shortly after that, and this is a famous picture from the Times. These are babies that were in incubators, and when the electricity failed, the staff snuggled them all together, hoping they might stay alive from each other's warmth. The New York Times said they were unconvinced that there was any command center, and during this assault, patients in the ICU and NICU died. So the hospital was pretty destroyed until February of this year, when they were reconstituted with some fuel that was used to resupply the hospital. they sort of perked up and were providing more care. And then on March 18th, there was a massive assault. And at that point, there were 30,000 people sheltering in the Al-Shifa hospital complex. The attack ended on the 31st of March. Now, I just want to point out that Ehud Barak, former prime minister, was being interviewed by Christine Amanpour on CNN. And he was like, what are you talking about? The Israeli engineers built the tunnels under Al-Shifa in the 1980s to increase the hospital capacity in high-risk areas. There are tunnels under all the hospitals. We built them. We have tunnels under our hospitals. This is how it is in high-risk, war-torn areas. And he said this to her total astonishment. So on March 31st, the Israeli forces claimed that they had conducted a precise operation and killed about 300 people with 6 tanks and 100 commandos. They arrested over 900 people. They claimed major Hamas stockpiles of terrorists. Hamas and the hospital staff denied this. People described bodies everywhere, tanks rolling over them, children, innocents, arms, legs. It was just horrific. Doctors were stripped and humiliated and detained. Patients died from all the things you can imagine. And companions were arrested, summarily executed, and displaced from the hospital. This is a picture of the hospital in April. And in May, 8 mass graves were found in a number of hospitals, including Al-Shifa, with over 500 bodies. And this included women and children, many reportedly showing signs of torture, summary executions, and potential instances of people buried alive, according to the UN. And the Israeli forces denied they had anything to do with this. Now, in Gaza, there are 50 to 60,000 pregnant women who are not getting prenatal care, who are repeatedly displaced, who have no money, and who are unclear where they will deliver. The picture on the right is a woman who just had a baby in a tent. There are about 180 women a day giving birth without adequate care. So these women are giving birth in shelters, in their homes, in the streets, amid the rubble, in overwhelmed healthcare facilities where they're basically competing with the injured. Sanitation is horrific, the risk of infection is high, medical complications are high. And the latest finding I could find on obstetrical and newborn care is that there are now 11 hospitals, counting field hospitals, that have some ability to do obstetric and newborn care. So these women and babies lack food and clean water. They are starving and dehydrated like everyone else, but they are a particularly vulnerable subgroup of society. And not only does this impact health, but it also impacts the ability of the mother to bond with her child and to breastfeed. So if you're starving, you cannot breastfeed your baby. So you need to get formula. You need to have money to buy formula. You need to have formula available that you can buy. And then you get the powder and you have to mix it with water, which is contaminated. So this is just a catastrophe on a catastrophe. Maternal deaths have increased 3 times. There's also the issue of what I call unregistered deaths. So babies that are born in the rubble and die quickly may never get registered with any authority. So we may never even know how many newborns died. And there's also increased preterm and low birth weight, obviously. There's a huge psychological toll, and that also impacts reproductive health. There's been a 300% increase in miscarriages, as well as increases in congenital abnormalities and stillbirths, and this will have a multi-generational impact. We know that in this kind of setting, women and girls are especially vulnerable. There's a lack of healthcare resources, hygiene products, safe spaces, education. And so women and girls are really vulnerable to the negative outcomes that you would imagine. Maternal and newborn deaths, postpartum depression, sexually transmitted diseases, UTIs, gender-based violence, and then diseases resulting from lack of clean water, lack of hygiene, and limited control over their reproductive choices. So it's estimated that there are more than 500,000 women that lack pre- and postnatal care, family planning, and STI treatments. And this was an interesting graph from the British Medical Journal surveying Gaza's mortality data. And what they saw was that the proportion of women, which is the dark red, and children, which is the next line up, the proportion of deaths is the same as, it's indistinguishable from indiscriminate bombing of civilians. So all of those curves are the same. So they used geospatial data. They looked at where the large bombs were used in densely populated areas. They looked at statements from Israeli military officials and politicians, and they stated, quote, we have strong reasons to believe that insufficient attempts are being made to avoid civilian casualties, and that this would amount to a war crime and a plausible breach of the Genocide Convention. And then they called on Western governments to do something. So that leads us to international humanitarian law. This was codified in the 4 Geneva Conventions of 1949, which outlined the protection of civilians in times of war and treats as war crimes the murder of civilians, torture, rape, and hostage-taking. So international humanitarian law is part of international law, the body of laws that govern relationships between states. There have been additional protocols since regarding protection of victims in armed conflict, as well as other agreements like prohibiting the use of certain weapons like white phosphorus, or military tactics. And then in 2000, there was the protocol to the Convention on the Rights of the Child involved in armed conflict. So in January of 2024, South Africa lodged a complaint against Israel of having a pattern of genocidal intent, and they lodged this with the International Court of Justice, which is the court that's in the United Nations. And so what is the crime of genocide? This was defined in 1948, and genocide is defined as specified acts committed with intent to destroy a national, ethnical, racial, or religious group. Acts include killing members of the group and deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part. In May, the International Criminal Court, which is a totally separate court, not under the UN, it's separate, issued a statement that they're considering an arrest warrant for Netanyahu and his defense minister on 7 charges, including deliberate starvation of an entire population. And they're also considering arrest warrants for Hamas leaders charged with war crimes and crimes against humanity. They just issued another statement which basically said the occupation is illegal and should stop, which they keep saying. But the thing that's different about this statement is that they said all states and international organizations are obligated to not recognize the occupation. So they were calling on the international community to not be complicit in the Israeli occupation. So they're upping the ante here. Now, how this gets all put together, I'm going to read this because it's sort of the basic take-home message. More than 75 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and permanent displacement of refugees, severely impacting the ability of Palestinians to access the essential building blocks of health. The fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is recognized today as 2 separate systems, 2 separate realities. And we see the impact of these disparities on life expectancy and maternal and infant mortality. And this happens because of the deliberate de-development of the healthcare system, all the restrictions, and the direct attacks in a conflict, an area of high levels of conflict-related trauma. So if we're going to address the maternal child health catastrophe in Gaza, we need to be thinking about violations of international law. We need to be thinking about the collective punishment that has been wrought against women and children, the multi-generational trauma, the ethnic cleansing and genocide that feel very apparent, and the underlying racism, revenge, and dehumanization makes this all possible. It's also clear that the health of Palestinians is intrinsically linked to their liberation and to the end of the siege. Our job as internationals is to work as hard as we can for a ceasefire, to get massive humanitarian aid into the region, to get a release of the hostages, and then to address the root causes so we don't have to do this over and over again. And the basic problem is that we have to end military solutions to political problems. We also know that health workers have been silenced in the United States. There are multiple reports of pushback from staff and administrators. I'm sure some people have experienced this. And these include warnings of dismissal, loss of residency options, accusations of anti-Semitism. I personally was supposed to give a talk at the Dartmouth Medical School called Geisel, and I got there and they had indefinitely postponed my talk. I had a talk scheduled at Harvard Medical School at the Brigham and Women's Hospital, and I got there and they had canceled it. And so we rescheduled it at the School of Public Health, where it was canceled again. And I heard from some faculty who were at the faculty meetings to discuss this dangerous person coming on campus, that one of the higher level people in the Harvard system told everybody that I was an anti-Semite and I was not allowed to speak at Harvard. And I did write an article in the Health and Human Rights Journal entitled, "Can Healthcare Personnel Speak Out on Health and Human Rights Issues in Gaza?" This is a picture of Hassan Jabbar, who was a nurse who, after she received an award for her great care of women and children, was promptly fired because she mentioned the genocide in Gaza. So what can we do? I think healthcare personnel are uniquely positioned because we can talk about healthcare and we have some credibility, deserved or not, and people will listen to us. So part of our job is to educate ourselves, our communities, to challenge the mainstream media, to challenge our professional organizations. There is only one professional organization in medicine that has said anything about the Gaza assault, and that's the American Public Health Association. We're trying to make another statement, and it was just recently blocked, so clearly there's opposition within the APHA, but not a single obstetrical, pediatric, orthopedic, nothing. There is silence. And these are organizations that made a ton of statements about, for instance, Ukraine. So it's not like they don't talk about international issues. We should, as physicians and healthcare providers, be showing up in the offices and on mail and whatever with our elected officials. They need to hear from us. We need to sign calls for ceasefire and protests. And when we're protesting and demonstrating, we need to wear our white coats and make it clear the people who provide healthcare are protesting and find the current situation completely untenable. It's also important to support organizations doing work here and in Gaza, and for us not to stop until there is a ceasefire. So I want to be sure that you know, I think we should be really pressuring our professional organizations. I want you to know about Healthcare Workers for Palestine, which is a national organization that also has local chapters and is very active in having the healthcare voice out in this conflict. There's a group called Nurses Against Genocide. There's a group called Doctors Against Genocide. I am involved with Jewish Voice for Peace Health Advisory Council. I curate a weekly report on the health and human rights implications of this war. And if you want, every Saturday or Sunday, it's up on the website, jvphealth.org, and we want people to read it and to share it with everybody they know. I also have a lot of articles and talks on my own website, alicerothchild.com. The books one is for the kids' books. My grown-up website is just my name. And here's a list of some of the groups that are involved in work in Gaza, and some of them, function, and then they don't function, and they do function, but there are a lot of charitable organizations that are working in Gaza. And I just also want to tell you a moment about the Gaza Scholarship Fund for Displaced Students. As I mentioned, I'm involved with We Are Not Numbers, and a number of the mentors have created this group that has been raising money because Gazan students have had their university education totally disrupted, and their universities are now rubble. So they have located 29 colleges and universities that are willing to provide, currently we're at 52 full scholarships to these Gazan students. These are for students that have gotten out because obviously since May, when Rafah was closed, no one is getting out. And so this is another way to support students that are trying to survive. Thank you.